Hi, I'm Dr. Bhupesh Karthik, consultant orthopedic surgeon. I specialize in keyhole surgeries for knee and shoulder. Today I will be talking on InfiLoop by Sironix, the closed loop suspensory femoral fixation device for ACL reconstruction. As we all know, for soft tissue grafts like hamstrings and peroneus, suspensory femoral fixation is gold standard. There are two types of suspensory femoral fixation devices. One is the closed loop and the other is the adjustable loop. There are various studies which shows that there are no big differences between the both. However, it is surgeon's choice to choose the adjustable loop or the closed loop. I prefer the closed loop fixation device. Understanding the InfiLoop. The InfiLoop comes with a 12 mm button with a 15 mm or 20 mm or a 25 mm loop. There are two holes on either side of the button. The white tiger suture is the lead suture and the black suture is the flipping suture. The InfiLoop XL comes with a 14 mm button and the same configuration. To do the surgery, you will require a 4.5 cannulated drill bit, depth probe and endoscopic reamers. The first step after placing the bead pin is reaming with a 4.5 cannulated drill bit. Let us say that the tunnel length is 40 mm. The graft length plus loop length would be the total tunnel length. The desired graft in the tunnel is 20 mm, and so in this scenario 20 mm will be the loop length. The second step is the important step, which is reaming with graft size reamer. The reaming length has to be calculated, and this is the graft length in the tunnel plus 10 mm. Why this 10 mm? The 10 mm is the optimal length required for a 12 mm button to flip from a 4.5 aperture in the far cortex. The graft is marked at 30 mm, and the third step is graft passage. The graft is pulled into the femoral tunnel with the lead suture, which is the white tiger suture, till the 30 mm mark comes to the aperture of the tunnel. The button will travel in a vertical manner through the 4.5 reamed tunnel to reach the outer cortex. The fourth step is the button flip. Once the graft is fully in the tunnel, the button is flipped by pulling the black flipping suture. Now the vertical button comes to a horizontal position, and the surgeon can alternatively pull on the lead suture and the flipping suture to feel for the toggle. The fifth step is the most important step, and the graft is pulled back to tension the loop. Now the horizontal flipped button will securely sit on the far cortex of the lateral femoral condyle. The 30 mm mark which is made on the graft will come down into the knee by 10 mm. Here is a shortcut to calculate the reaming distance. If you are using a 15 mm InfiLoop, you will ream the tunnel length minus 5 mm. For a 20 mm InfiLoop, you will ream tunnel length minus 10 mm. For a 25 mm InfiLoop, you will ream tunnel length minus 15 mm. In real life scenario, let us say you have a 38 mm tunnel and you decide to use a 15 mm InfiLoop. The reaming distance will be 38 mm minus 5 mm, which is 33 mm. By doing so, you will have a 23 mm graft and a 15 mm loop to finish your surgery. Thank you.